Thank you. Good afternoon, Chair Levin and members of the council. Thank you for convening this hearing today. I'm here to testify on behalf of the Homeless Can't Stay Home campaign and reiterate much of what has already been said at this point, but to emphasize the hazardous conditions that make congregate shelters breeding grounds for COVID-19. In congregate shelters where bedrooms and bathrooms can be shared by dozens and eating in common spaces used by hundreds daily, social distancing is undeniably impossible. As early as March 31st, FEMA released guidance to eliminate congregate housing, and shortly afterwards approved New York State's plan for non-congregate sheltering to include homeless persons. In a press conference on April 18th, Governor Cuomo recognized that any congregate setting is a concern, yet as of today, April 23rd, only 6,000 hotel rooms are available for those experiencing homelessness, when 30,000 individuals are still sleeping in congregate settings or on the streets, many of whom have underlying chronic health conditions and are considered extremely vulnerable. As Councilmember Levin has already highlighted, asymptomatic spread is a very big concern and further supports the need to isolate oneself from others. A homeless shelter in Boston that underwent large-scale testing revealed asymptomatic spread happening at an alarming rate. There's no testing happening in DHS homeless shelters. DHS does not have a centralized understanding of who in their shelters has underlying conditions, and it only takes one asymptomatic individual living in close proximity with a vulnerable population to create a significant outbreak or a super spreading event. Even more concerning, members of our organizations have shared corroborating reports that their shelters have been lacking a real response to this crisis. Administrative staff at DHS are not living in shelters. They do not have an accurate sense of what the reality is on the ground. Our members are living in shelters every day, and I'm inclined to believe their reports over DHS. They're telling us that beds are only 36 inches apart, cleaning has not increased, and clustering in shared spaces continues despite CDC guidance. PPE is unavailable for staff and clients alike. On numerous occasions, members have told us disturbing reports that other clients in their shared rooms are coughing and sneezing through the nights and are not being removed for isolation. DHS guidance for isolation requires staff to identify clients exhibiting COVID-like symptoms. We can confirm from inside of the shelter system that this is not happening regularly. Regardless, this reactive policy to move people once they are showing symptoms is by no means adequate. Once an individual is showing symptoms, they are already sick and have spread the virus to countless others through shared surfaces and spaces. Moving homeless New Yorkers into individual hotel rooms proactively flattens the curve and allows everyone the chance to protect their health. Shared hotel rooms are a dangerous shortcut that does little to prevent infection. And an individual cannot be held accountable for the decisions and actions of a roommate that sleeps less than 6 feet away, uses the same bathroom, and shares the same surfaces in a hotel room. People are scared, and our organizations have been trying to comfort our members through this unprecedented and seemingly hopeless time. If New Yorkers stay in congregate settings, hundreds, if not thousands, will die. Our mayor has failed to grasp the severity of the situation for homeless New Yorkers, and we commend City Council for holding this hearing and hope that you respond to this crisis using science, facts, and empathy. Thank you.